You were sent home with 3 medications for pain management and blood clot prevention. So the aspirin 325 milligrams, you're gonna take that once a day for blood clot prevention for the first 2 weeks. You have a script for naproxen, that's an anti-inflammatory. It's 500 milligram tablet. You're gonna take that twice a day with food. It's the same thing as Aleve. And then you're also given a narcotic, the hydrocodone. You'll take that 1 tab every 4 to 6 hours as needed for breakthrough pain. Once you find that you're not needing the narcotic anymore, you can safely transition to Tylenol at that point. We do ask that you don't take any other anti-inflammatories for the first 2 weeks, just because you're on the aspirin and the naproxen. If your pain is uncontrolled, then you definitely need to reach out to our office. So if you're finding that breakthrough pain is not controlled with the narcotics and the medication that we gave you, please reach out to our clinical triage line. If you're experiencing any post-op nausea, vomiting that is not getting better, please reach out to our clinical triage line and we can send in an anti-nausea medication for you. Anything concerning with the knee, so red flags that we would be concerned about: increased redness around the incision area, uncontrolled swelling post-operative. So if that swelling is not improving with ice and elevation, then we definitely need to hear about that. If you have draining that's not improving from those incisions area, so consistent bleeding, any signs of inflammation or pus from the drainage or from the incision area, we definitely want to be aware of that. So those would be red flags. Fever, if you're running a fever over 100.4, we want to hear about that as well. It's not uncommon to have a low-grade fever after surgery, but if there's anything that's over 100.4 that's not improving with Tylenol, then we want to know about that as well.